Mental health in the workplace. It's everybody's business. My name is Rhea Mohenoa and I'm a service manager at Acora's. I'm a social worker with an educational background in behavioural and educational psychology and a master's in social work. I've had 11 years experience in the fields of child and youth mental health and child protection, and I'm an accredited youth mental health first aid facilitator. I have worked in services that have supported clients and consumers both at the bottom and at the top of the cliff. And I have seen firsthand the benefit of walking with clients along the pathway, veering them away from the cliff altogether. That's what we're all about at Acora's. Supporting children, young people, individuals and families early in their journey of struggle, helping to resource and support them to get back on track. That's also what I'm going to be talking to you all about today. How each and every one of us has a role to play in supporting the positive mental health and well-being of our staff and colleagues in the places and the spaces that we engage in daily. We'll be covering briefly what mental health is and what it isn't. We'll talk about the prevalence of mental health concerns in our society, as well as common mental health concerns we might see in our workplaces. We'll look at the risk of unaddressed mental health concerns, including things like the worsening of mental health problems, the effect on staff morality and culture of organisations, and the effect on productivity and output. We'll talk about what we can all do as colleagues, individuals, employers to help create a space that is safe and welcoming for everyone we work with. Lastly, we'll talk about simple steps that we can commit to take care of our own mental health and well-being. What is mental health? The World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health is really about wellness rather than illness. It is important for us to differentiate between mental health and mental illness. Mental illness can affect anyone of any age and any background. Mental illness is a diagnosable condition that needs to meet certain criteria. Generally speaking, in order for poor mental health to fit into the category of diagnosable mental illness, we need to see three things. We need to see major changes in how someone is thinking, feeling, or behaving that causes disruption to their day-to-day life, so they aren't really able to do the things that they should be able to do, and that these changes don't go away as quickly as they should. So, for example, we all have bad mental health days. We all sit on that lower half of that quadrant. I have kids. Maybe we've had a few nights where my kids aren't sleeping, where I've been running late for work and getting behind on deadlines. Because I'm stressed all the time, I just pick up takeaways on the way home from work, so I'm not eating healthily, and I'm not able to wake up in the morning to exercise. These can make me feel quite low and moody. It may even affect my ability to turn up to work one day. I might just need a day off. In this situation, I'm sitting on that bottom half of the chart. I'm sitting in that poor mental health space, but I'm sitting on the left where there's no mental illness. However, if these things continue, and if I don't start doing some good self-care and looking out for myself, it may start to really impact my ability to take care of my kids and more regularly affect my ability to turn up to work. That's when I'm possibly moving to the right side of the bottom half, where I've got poor mental health that may be turning towards becoming a serious mental illness. It's really important that we understand both, as in the workplace we see both. But having a mentally safe and healthy workplace gives us a much better chance of supporting colleagues and employees to reduce the risk and likelihood of moving between those quarters. Also, having a positive space where people can turn up to work every day just generally increases the chance of us helping people to remain in that top half of that quadrant altogether, where there's optimal mental health. So how common are mental health concerns in our society? It is estimated that 45% of Australians will experience a mental health condition in their lifetime, the most common being anxiety and depression. Given the statistics, it's highly likely that we will come across mental illnesses in our workplace. A worker may develop mental illnesses prior to or during employment. Most workers are able to successfully manage their mental illnesses without impacting on their work. Some might require workplace support for short periods of time, and a minority may require ongoing workplace strategies. 1 in 5 Australian workers is currently experiencing a mental health condition. It's often presumed that mental health concerns develop outside of the workplace. However, an unhealthy work environment or a workplace incident can cause considerable stress, which may exacerbate or contribute to the development of a mental illness. Despite 20% of Australians experiencing mental health concerns, nearly half of all senior managers believe that none of their workers will experience a mental health concern in their workplace. While we have 1 in 5 Australians currently experiencing a mental health condition that's diagnosable, a further 1/6 of the population is suffering from symptoms associated with mental ill health, things like worry, sleep problems, and fatigue, which may not meet the criteria for diagnosed mental illnesses, will definitely be affecting their ability to function at work. What are some of these common mental health issues that we might see? So we got stress. It's a normal condition that everyone experiences. It's often confused with anxiety. However, it's not a diagnosable mental health illness. Within limits, stress has positive effects on our motivation and our performance. Too little stress could cause problems too. It might be hard to motivate ourselves to complete tasks without a deadline. Too little stress can also lead to things like negative rumination or feelings of not making progress or failure. It can also reduce the amount of positive feedback, both internal and external, and lower the sense of personal satisfaction. All of these things can also contribute to mental health issues. Too much stress, on the other hand, deteriorates performance. When stress is sustained over long periods of time, physical health can also deteriorate. Research studies have shown the direct ongoing link between ongoing exposure to stress and the increase in risk of both depression and anxiety. Depression: sadness, low mood, and or moodiness that lasts for long periods of time. We all feel sad or low from time to time, but some people experience these feelings intensely for a long period of time, and sometimes for no apparent reason. 1 in 6 people will experience depression at some time during their life. Common signs of depression include things like lowered self-esteem, lowered self-worth, changes in sleep patterns and appetite, less ability to control emotions such as pessimism, anger, or guilt, and reduced capacity to experience pleasure. If these kind of signs persist for most days, over a 2-week period or longer, and they start to interfere with one's ability to manage at work or at home, it may meet the threshold for a diagnosis of depression. Anxiety. Just as there are times when we may feel down but not clinically depressed, there are times when we feel anxious but don't have an anxiety disorder. It's normal to feel anxious in high-pressure situations, such as a job interview, when there are changes in your life, when presenting a webinar. Similar to stress to a degree, anxiety can help us by helping us stay focused and alert. However, it becomes a problem when the feelings of anxiety are constant and even around minor things, and when they also start to interfere with our day-to-day life. Anxiety disorders, and there are very many numerous ones, have a mix of psychological symptoms such as excessive worry, poor concentration, specific fears, physical symptoms such as fatigue, muscle tension, upset tummy, and behavioral changes such as procrastination and avoidance, or difficulties in making decisions. To meet a diagnosis of anxiety disorders, a combination of symptoms is present on most days for more than a 6-month period, and it interferes with your ability to function at work or at home. 1 in 4 people will experience anxiety during their lifetime. With such high rates of possibility of mental health and mental illness, what are the costs of not acting? Work-related mental health conditions, which are also known as psychological injuries, have become a major concern of Australian workplaces. Safe Work Australia say that 7,200 Australians are compensated for work-related mental health conditions, which equates to around 6% of workers' comp claims. Approximately $543 million is paid in workers' compensation for work-related mental health conditions. Additionally, preliminary research also shows that Australian businesses lose between $6 to $11 billion each year by failing to provide early intervention and treatment for employees with mental health conditions. And that's due to the negative impact it has on individual employees and the costs associated with long periods of time away from work that are typical of these claims. Work-related stress has been linked with high levels of unplanned leave, including sick leave, staff turnover, withdrawal, and turning up to work when people are unwell and really shouldn't be there. It also leads to poor work and poor product quality. Between 2010 and 2011, and 2014 and 2015, 91% of workers' compensation claims that involved a mental health condition were linked to work-related stress, with two leading reasons. One being work pressure, accounting for around half of all those claims, and the other being work-related harassment or bullying, which accounted for a quarter. It's really clear that the cost of ignoring the problem is far greater than the cost of developing and implementing strategies that create safe and healthy workspaces. But what about the cost for individuals? While the potential costs for businesses and organizations are high, the cost to individuals are much higher. And these individual costs impacts families, communities, and societies as a whole. As we discussed early on, we can all have bad days and experience signs of mental health concerns. However, when these are not supported or addressed in a timely manner, this increases the risk of these problems worsening and the potential for mental health concerns to lead into longer-term mental health illnesses. Additionally, the longer we wait to intervene, the more likely that episodes will occur more regularly, and the possibility of additional mental health concerns showing as well. For example, not intervening early enough for someone who may be experiencing symptoms of depression can increase the person's risk of experiencing additional symptoms in line with anxiety. There's also the additional risk of use of alcohol and other drugs to mask symptoms, which, if this isn't supported early enough, could lead to a substance misuse problem. Lastly, a very real concern for our society is the increased risk of suicidal thinking and/or suicidal attempts. Suicide remains the leading cause of death for 15 to 44-year-olds in Australia. It is a major cause of preventable death and a significant health issue for our society. The human and economic costs of suicide are substantial, and we know that for every death by suicide, that there are 30 attempts made. Suicide attempts are also a significant public health problem, as attempts can result in permanent and temporary disability. So crucial that workplaces try to be set up to be safe and healthy, because for the working population, this is where we spend the majority of our time. So creating a safe and healthy workplace. All employers and managers are obliged to take appropriate steps to eliminate and minimize health and safety risks in the workplace. Workplace Health and Safety Acts across all jurisdictions in Australia define health to mean both physical and psychological health. As such, employers need to identify possible workplace practices, actions, or incidents which may cause or contribute to mental illness, and take actions to eliminate or minimize these. Recognizing and promoting mental health is an essential part of creating a safe and healthy workplace. Research shows that developing a combined systems approach that incorporates both individual and organizational structures is the most effective way to intervene in relation to job stress and improve employee health and health behaviors. Both managers and workers have a part to play in building a safe environment, one that will not create or exacerbate mental health problems, and one where workers with mental illnesses are properly supported. What are some characteristics of a healthy and safe workplace? A place where professional development is supported and encouraged, where obstacles to optimum mental health are identified and removed, and a place where diversity is viewed as an organizational advantage. If we see these characteristics in an organization, we're much more likely to see the next few. We're much more likely to see an organization where staff turnover is low, staff stress and sick leave is low, where staff loyalty is high, and where workers feel and are productive members of a team. A key component to the success of creating a safe and healthy work environment is commitment and awareness. Commitment and awareness from senior managers and staff to develop a healthy working environment through things like mission statements, policies, and procedures. Managers demonstrating commitment by implementing these strategies, and staff demonstrating commitment by holding managers and other colleagues accountable. Proactive organizational measures could include things like having effective policies and procedures, policies around equity, non-discrimination, policies that allow feedback, offering flexible working arrangements, later start times, early finish times, ability to work part-time, ability to work from home, developing things like mentoring and peer support, and providing access to counselling through things like EAP programs. Also, developing a greater understanding and awareness of mental health and wellbeing more generally through training of all staff, as well as ensuring safe and healthy work conditions, regular breaks, limit on overtime and workload. While these things are to be considered on a governance and organisational level, more practically, there's things that each of us can do. Research demonstrates that the way our jobs are designed and our organisations are structured and function impact our mental health and well-being. So too does the support that we receive in the teams that we work within. So what can teams do? Have regular, informal conversation with all team members. Build an ongoing feedback loop. Take time to chat with everyone. It's an opportunity to get to know each other as individuals. It's also more likely then that you'll be aware and notice changes in both behavior and performance earlier, and that you'll have an established relationship so that you'll feel comfortable to ask about their health and well-being. Everyone benefits by being clear about their role. A key component of workplace stress is lack of role clarity. Find regular opportunities to discuss tasks and what's expected. What's expected of you as an employee? What's expected from your team leader? Encourage trusting and respectful communications. Always have private and sensitive conversations in places that provide privacy and respect. And help make work meaningful. Help employees link what they're doing to the wider direction of the organisation that they're working within. Help them feel valued and connected. Set the standard. If you witness or hear inappropriate behaviour or communication, intervene promptly. All of us should be helping. Acknowledge good work and practice when it's occurring, and offer support through organisational resources. And really importantly, access those resources yourself. What else can we do? Having regular, simple, informal conversations really help to build that sense of belonging and connection, which has been shown to promote well-being. Find the time to ask about people's weekends, to have a chat about how the holiday was, to share your thoughts on the most recent episode of Survivor. Ask how things are going. The more we check in, the more we'll be aware if something's not okay. If you notice changes in people's behaviours or performance, take time to consider whether this could be due to a mental health concern. You may notice things like change in routines, someone who's always on time for work, maybe turning up late. You may notice symptoms associated with high levels of anxiety or lowered mood, lowered concentration or performance. If you see things like these, it's really important that we ask if things are okay. They may want to talk or they might not. But what we know from research is just by letting someone know that you've noticed and that you care, in and of itself, can make an enormous difference. Lucky for us, we've got the Are You OK campaign. Are You Okay have given us some really easy and relatable steps to follow when asking if someone's okay. Their website covers all of these in detail, and they also have videos that role-play how this conversation could pan out. Step 1, ask. Before getting to step 1, ensure that you yourself are in an okay place to ask. Just like in an aeroplane, we need to put on our own life jackets before we can help someone else put theirs on. If you're not in the right headspace or you don't feel like you're the best person, try to think of someone else in that person's network who may be able to ask them how they're doing. If it's going to be you, check in with yourself, that you're willing to genuinely listen, that you're willing to hear that things aren't okay, that you understand that you can't fix everyone's problems, and that you're ready to give them as much time and space as they need. Try and pick a suitable time, somewhere that's private and comfortable. Also be ready and willing to hear that they don't want to talk. If they are talking and you are asking, be relaxed and friendly. Focus on specific things that you've noticed, changes in behavior. Encourage them to talk by asking open-ended questions. If they don't want to talk, tell them that you care about them and that you're still around, you're still concerned. Leave that door open so they can reach out when they're ready. Avoid any criticism or confrontation. We can't force people to talk if they don't want to. Step 2, listen. Have an open mind. Don't rush the conversation and don't interrupt them. Don't judge their experiences, but acknowledge how they're feeling and validate that things feel tough for them right now. They may need time to sit patiently. Be patient and sit comfortably with that silence. Show that you're listening and understanding by repeating what you've heard in your own words and check your understanding. Step 3, encourage action. Ask them what they've done in the past that's helped, or ask how they'd like to be supported. If they've been feeling down for some time, longer than 2 weeks, encourage them that it may be helpful for them to get some professional support and be positive about the role of professionals in helping them to get better. Offer them help to linking in with professionals and finding someone that might be able to help. If during any point in your conversation you are worried or the person indicates suicidal thinking, ask them if they're feeling suicidal. It's a big question, it's a really tough question, but it is the most important question. If they indicate that they are, it is even more important that you can sit with them and support them until they can be linked in to professional support. This may look like calling Lifeline or arranging an appointment with them to see their GP, or if they're feeling extremely low and at risk, calling them an ambulance. Step 4 is to check in. Pop a reminder in your diary to call them and check in again in a couple of weeks. If they're really struggling, follow up with them sooner. Stay in touch and be there for them. Genuine care and concern can make a real difference. While it's really, really important that we ask how people are when we're worried about them, it's also really important that we all work together to try and keep ourselves feeling good and okay. Thinking back to the beginning, we want to try and position ourselves to remain in the top half of that chart. To do that, we need to focus on maintaining our well-being. Well-being is generally thought to be made up of 2 components, feeling good and functioning well. Feeling good can include feelings of happiness, contentment, and joy, curiosity, all of which contribute to positive life experiences. Functioning well can include experiencing positive relationships, having some control over our lives, and a sense of purpose. These 5 ways to well-being are a set of evidence-based actions which promote people's well-being. They've been developed from research conducted by over 400 experts in psychology, psychiatry, neuroscience, education, and economics from across the world who've reviewed current knowledge on mental health and well-being. The 5 ways to well-being are to connect, be active, take notice, keep learning, and give. These activities are simple things that individuals can do in their everyday life. This awesome resource from 5waystoWellbeing.org provides simple examples of how we can also implement these things in our workplace. So connect. Think about the way that you interact with the people that are closest to you, your family, your friends, your colleagues. Try to increase the amount of positivity in these interactions. In the workplace, establish staff interest groups, like book groups, potluck lunches once a month, after work drinks or catch-ups. Be active. For ourselves, exercise makes us feel good. It releases endorphins, which lift our mood and can create resilience to managing stress. In the workplace, get up and walk to a colleague's desk to ask that question instead of sending that email or jumping on Teams. Take notice. It's about practicing mindfulness, being aware in the here and now, not focusing on things that have gone or things that are coming, just being fully present. At work, take a minute to step away from your desk during a scheduled break. At the end of the day, ask your colleagues what was the best thing about their day and listen with interest. Keep learning. Take on new roles, develop new interests. Seek out opportunities at work for professional development in a skill or area of interest. Put your hand up for additional stretch activities. Give. For ourselves, think of the bigger picture. Give gifts of time. Do acts of kindness. Enjoy helping others. At work, notice good work. Give colleagues compliments for what they do to ensure that they're aware of the awesome job that they're doing and the value that they bring to your workplace. At the end of the day, mental health is everyone's business. We've got some helpful resources where a lot of this presentation has been drawn from. And just remember that support is always available.